All right. Good evening, everyone. It's great to be here for another community convo. My name is Ayana Polk, and I'm the Director of Community Partnerships here at Vital Connections. And as you all know, every month we come together to talk about health topics that we've all been wondering about, that we never have the time or space to discuss with either our friends, our families, or most importantly, our care providers when we're in the room. So I'm really excited to bring us here for another topic, a discussion that's really important to us all, which is Black maternal health. I'm just really thankful for the conversation we're about to have today. We're going to be sharing space with all of you and three phenomenal women who are changing the face of maternal health here in Boston, which is Nashira Baril of the Neighborhood Birth Center, Stephanie Johnson, who is the owner and CEO of Roots Midwifery, and Dr. Liza Swedarsky, who is an OBGYN and founder of Health Vows. Before we start, in regular Vital Connections fashion, we'd love to ground this conversation in a shared understanding of why we're focusing on this important topic today, and share a bit about the work that we've been doing here at Vital Connections to advance Black maternal health equity, especially in Boston and beyond. To kick it off, I'm going to pass the virtual mic over to our executive director here at Vital Connections, Ariel Childs.
Hi, everybody. Thank you so much for joining us tonight for this really important conversation.
It's hard to prevent this sort of thing from happening. Thank you. Well, I enjoyed Chess.
It's nice to have you all here. A few things. So first, I just wanted to say that this conversation is sadly not new, right? It's been happening for generations, and it's just important to us to start by honoring and centering the history of often BIPOC-led reproductive and birth justice movements that have come before us and really provided a foundation for us to build upon. In that same vein, and in an effort to have some shared language around maternal health and reproductive justice, we wanted to start by co-signing this well-known and always relevant definition of reproductive justice. This was developed by an organization collaborative called Sister Song, which is a woman of color-led collaborative advancing reproductive justice. And we just wanted to assert that we believe in the human right to maintain personal bodily autonomy, to have children, not have children, and parent the children we have in safe and sustainable communities. And that definition is really sort of the North Star of the work that we're doing here. We also wanted to create space for a shared understanding of the current state of Black maternal health. Again, this data is not new, but it's always hard to face, and it should always be hard to face until it gets better. So I just wanted to preface this data sharing with that acknowledgement that this can be really hard. Currently, Black women are 3 times more likely to die from pregnancy related deaths than their white counterparts. And 80% of these deaths are preventable, which means that we need to do things differently because we can prevent these devastating deaths from happening. This data hasn't really changed since the 90s when it began to sort of get the attention it deserved. And it really hasn't changed despite the enormous amount of resources poured into healthcare delivery systems of care. So these resources have led to citywide improvements in birth outcomes at large, but tragically, maternal and infant health outcomes for Black residents specifically have continued to worsen. So it's very clear sort of which population these systems of care are leaving behind in this fight to advance better maternal health outcomes. I think it's important for us all to acknowledge that despite these improvements, the US as a whole is in a maternal health crisis, right? These outcomes for birthing people, regardless of race, are nowhere near where they should be. But because of systemic and structural racism driving health inequities across the board, we see a disproportionate and devastating impact on Black and birthing families. And that's what brings us here today. We know that maternal health inequities are driven by systems and processes process design rooted in structural racism, but that means that we can also redesign these systems and processes to have more equitable outcomes. And so here at Vital Connections, that redesign work is what we are set out to do. And we are doing that in ways that shift power to community stakeholders, ensuring that the strategies and solutions that we're lifting up are not only driven by community members, but led by community stewardship. And when it comes to maternal health, because we know that nobody is doing well, we are working to lift up strategies that redesign from the margins, meaning that the person who has the least access to the birth that they need, want, and deserve, if they can have access to that birth, that means we all do better. We will all have access to equitable and just birth journeys. So we are doing this work in partnership with the new Commonwealth Fund for Racial Equity and Social Justice via a $2.5 million investment made by Mass General Brigham. So we are thankful for that. And our work is really about making maternal health a kitchen table topic, bringing it out of healthcare and making it an everybody issue that doesn't just center birthing families, but centers communities at large. Today, you're going to learn about services such as birth centers, midwives, and doulas, all of which have proven to improve maternal and infant health outcomes, yet which also have historically been inaccessible for Black and Brown folks. Institutional racism has taught us a lot about how these services are less than, and those are false narratives. And so the work that we're doing in partnership with the new Commonwealth Fund is reframing those narratives and spreading information and awareness about the power of these services that truly have offer the possibility of a more liberated birth experience. So we have collaborated with 6 different local organizations and businesses that were identified as trusted hubs within their communities. And through those partnerships, co-designed maternal health conversations that both spread information and awareness about community-driven and responsive maternal health services, while also lifting up community-based perspectives about how we can improve the maternal health ecosystem so that it's more aligned with what people need, value, and deserve. And we piloted these conversations with Spanish-speaking immigrant women, youth between the ages of 14 and 18, Black moms in Dorchester, educators, and this work is growing. So if you're at all interested in also bringing these conversations to spaces where you gather, your schools, your workplaces, your churches, please get in touch with us because we're looking for this work to grow, and we're working to get more and more people involved in this sort of collective effort to advance maternal health equity. With that, I'm going to pass it off to Ayana to get us started hearing from our amazing panelists and having some dynamic conversation.
Yes, thank you so much, Ariel, for giving a bird's eye view of the work that we're doing here at Vital Connections in support of you all, because I know it definitely takes a village to make sure that we're on the right track. So thank you so much for shedding light to where we are right now. And it cues us up perfectly for this conversation, which I've been eager and excited to have, considering who we're going to have tonight. So everyone who's going to be listening, feel free to, share in the chat. If you have any like questions or feelings that are coming up, because we all know that the birthing journey is very personal to us, whether we've had children or not. We know we've all been born, right? Whether you remember, you know that you probably have your parents telling you about when they stayed in the hospital for hours and hours on end, and what that felt like for them.
Thank
So
you.
I know I'm reminded all the time. But I know with me standing by my sister for 2 or 3 of her births, this is definitely a community conversation, no pun intended, because we all are here to support someone, whether it's ourselves or someone that we're close to with their birthing journey. So in true Vital Connections fashion, I'm going to make sure that I bring our panelists to the stage, the virtual stage, if you will, so that way we can get into the conversation. These 3 individuals are fierce trailblazers in their own right, have done a lot of work in the maternal health space, And I want to make sure that as I introduce them, we'll get into it in conversation, but this isn't everyone else's everyday panel, right? I want to make this as conversational as possible, as personal as you would like it to be, because we're amongst friends and family, and we want to make sure that we have that feeling as we talk about this, because it's so personal to all of us, especially this topic tonight. So first, I'm going to bring up to the virtual stage. Hold on one second. I am going to bring up Nashira Baril, who is the director of the Neighborhood Birth Center, which will be opening very soon. I've been watching and I've been waiting and I've been following all the progress. So thank you so much for making time for us tonight for this important conversation, because we want to make sure that we're making space for the special places like that you're advocating for and building right here in Boston.
Thank you so much.
Yeah, and then next, to cover a bit of the larger workforce that comes with the birthing journey. I'm really happy to have Stephanie Johnson here, who is the owner and CEO of Roots Midwifery. As we understand, the workforce when it comes to birthing is not just the people that you see in the hospital. There are so many people that help throughout the entire birthing journey, and I'm really excited to have Stephanie here to talk about the work that she's doing here at Roots Midwifery, and to kind of highlight and amplify the work that doulas and midwives play here in the Commonwealth and beyond when it comes to birthing. So Stephanie, thank you so much for having for joining us tonight.
Thank you for having me.
All right, and
Hi,
then
everyone. I see all my.
there you go. Yep. Remember, we're amongst family, so go ahead and say hi. It's cool. And I know I know with some folks that got their kids with them, that's perfectly fine. We understand it. Because sometimes they maybe even have something to say. So feel free to have them in the screen and wave hello. But finally, I want to bring up to the virtual stage Dr. Liza Swedarsky. She is an OBGYN here in Boston, and she is the founder of Health Vows, a really great organization that teaches advocacy for Black and Brown patients. So Dr. Swedarsky, thank you so much for joining us tonight.
Thank you, Ayana. It's such a pleasure to be in this space with you all. I'm really excited.
Yes. So I know through conversation, we'll touch on what you're bringing to the space, because I know on every panel, we usually read the bios and everything like that, but we're amongst friends tonight, and I want to make sure that we have as much time as possible to cover what's going on when it comes to Black maternal health. So first, I kind of want to just start with our first little opening question as to your why and what brought you to this space today, because we know that each of you have like an extraordinary experience, and usually it's not linear. Usually it's not 1, 2, 3, ABC, I'm here and it's great and it's shiny and it's perfect. But just wanted to know, I would love for each of you to introduce us to the work that you do and share a bit about your journey and what brought you here today. And I'll do it in reverse order. So I'll start with Dr. Swedarsky.
Yeah, so how did I end up on this journey in terms of, I am a practicing outpatient gynecology and minimally invasive surgeon. I've worked in 7 of Boston's community health centers, 4 federally qualified health centers. And when I decided to get my medical degree, it was very personal. Growing up in South Bend, Indiana, in severe poverty, although there was gifts in that, so many gifts, I felt that my life, there was a bigger purpose. And growing up without health insurance, I remember feeling the judgment when my mother would come in. There were 5 of us, 7 years apart. And we were rich in faith and rich in experience and rich with infinite possibility. And so I ended up deciding to go into medicine because I had this passion for women's health. And a lot of it stemmed from some of the really tough experiences I had as a Black woman growing up in Indiana. When I hit puberty, or there were conversations about sex and pregnancy and fear around teenage pregnancy, that there would be nobody to talk to, and kind of feeling like being alone in that journey. I remember there was a local Planned Parenthood that many of us would sneak off to if we wanted to get birth control pills or just learn about what our bodies were doing. And so I felt like I was drawn to and be in spaces to advocate for women. And I want women to have a voice, to speak to their power, to feel they can honor their questions, because we are all, I may wear a white coat when I walk into a room, but I feel like we all have an assignment in this world. And so I feel that I trained at Mass General Brigham and had my own challenges during my birthing experience with my daughter. And I have a different lens. So I've actually chosen to serve in community health centers. I've never worked in private practice. And I worked in a hospital-based practice once, but serving in community health centers is because I have a different lens of what the patient is bringing. When we talk about those social determinants of health, access to education, access to health care, food, fresh food. I remember picking a career somewhat based on what kind of stability would I have, but my true passion is letting each woman know that she's worthy of receiving the care that she deserves. And so that's what brought me into the field of gynecology. And then Health Vows was born out of my goal and desire that I really believe that change begins in the mind, and we're trusting a healthcare system that's not really built for us. We just, Ariel just went over the data, how it hasn't really changed, because I can tell you I'm in it. It's not built for us. And working in health centers, we're hearing a lot about castes and inequities and that sort of thing. And we still do not have equitable resources depending on where you receive your care. And so this is what drives my passion. And Health Vows is a program I created to empower women. So every space I go into, I pray that the participant in that group walks away with more knowledge about their health, because knowledge is power. Health literacy, so knowing what you need is very important. So I always want to provide tools. We underestimate patients. Like, you can understand what you need when we can find ways to explain what you need. Self-advocacy tools. How do I understand my needs, verbalize my needs, and get my needs met? Interacting with the patient-doctor relationship. Like, that's really the challenging part for many patients. And so I love to bring tools to say, when you're sitting next to one of us and we're on the computer too much, and you have how do you reframe that visit with your questions? So these are just some of the things. I have individual workshops, and I like to get into the community and do health education series so that somebody walks away with more knowledge. And as women, we talk. So we have a sister friend, we have a daughter, we have an aunt, our mothers, our grandmothers. And so when we spread that knowledge, it's life-saving, and that's often not happening in the office space. So.
Thank you, Stephanie. What's your why, and what's brought you here today?
Well, I have a story, but I'll shorten it a little bit. So when I think of my why, I think of being a child, even as a child, rather, always wanting to work with women and children. I always joke with people when I tell this story, even at a young age, I knew this was a calling for me. I just didn't know what midwifery was at the time, but I knew that I wanted to work with women and babies from a very young age. And so as I, went into college, my goal was to explore that. And at first it was going to be a pediatrician. And then I was like, nah, maybe not so many years of schooling, but, midwifery at the time was high on the list. And so I decided to enter into this space, not really even knowing about home birth at that time. And so when I was in school, I was told that it was going to be a 2-year wait for nursing school, even though I was already starting prerequisites for the classes. And me being a young mom at the time, my daughter was probably about a year old. And I was like, nope, I got plans. I need to get things done. And so I decided to change majors, but in the moment, it was like, this was still calling me. So what can I do in the interim? So what I did was take a bunch of classes and eventually became a doula and childbirth educator and lactation consultant. And yet this space was still calling me no matter what kind of pivots I had taken throughout the years. So eventually I revisited getting into nursing school, and I got in. And once I was there, I was like, I don't know if this is really the place for me after a year and a half of doing nursing school. And it just didn't resonate with the type of care, just didn't resonate with me. I really wanted more hands-on, more ability to educate and spend time with the people that I was working with. And I just felt like that wasn't going to be the trajectory of where I was going to go if I stayed. So I switched majors again, to my parents' dismay. Even though I was 2 semesters shy of graduating nursing school, I was like, yeah, not this. And so I ended up getting a different degree, and started doing doula work, and just kind of evolved over the years. And then I met people like Ariel and Maisha back in, I don't even know what year that was, but started working at Mattapan Health Center doing centering pregnancy. And that's where kind of things really bloomed for me, because it was like, oh, this is what I've been, looking for and wanting to do, even though at the time I was doing doula work, just really providing this type of care was what really felt like this was what my passion was. Spending the time to educate, spending the time to make sure people knew their options and knew that there's something different out here. A lot of times what we would see is that care was being done to these patients, but not really having any individualism to each person, right? And so I was back in college, and I thought I was going to take, my doula certificates and the childbirth ed and lactation, put it all in a pot with this second college degree and mix it all up and, make something great of it. And one of my mentors, Shafia Monroe, was like, no, I think you should go into midwifery school. The traditional midwives were people who were well known within the community. They had children, they had experience, and I was about to turn 40 at the time. And they were like, you're at the age, you have this wealth of knowledge that you can really share with your community. And to my dismay, and I always share the story with her, she did kind of yell at me and was like, you really need to look into this. And I did. And literally every door opened, from getting right into midwifery school to finding an apprenticeship, getting a full scholarship to go, like everything just kind of aligned. And that at that time just really solidified this is where my path was. And so here I am. This is my 5th year of doing Roots Midwifery, and Roots Midwifery is birthed out of my grandmother, who I never met. She passed away before I was born, and when I was in school, my very first semester, very first assignment was in relation to grand midwives in North Carolina, and that's where my dad's from. And so I happened to go downstairs and say, "Hey, do you know if this midwife, was your midwife? Were you born at home?" And he was like, I don't think so, but your grandmother was a midwife. And I'm like, say what? I had been working in birth work for probably 5 or 6 years at that point. My dad never mentioned anything about it. And so that also was another like kind of, sign, I guess, of like, this is where you should be, not meeting her, not knowing her history, and just knowing like there was always this pull to this work. And so growing this practice, I always keep that in the back of my mind of like, this was a calling and this is her living through me. Because unfortunately she had to, after finding out the story, find out that, she was actually banned from being a midwife, because it was right around the time where they in the South were, it was becoming illegal. And so unfortunately, she probably didn't work as long as she may have wanted to. And it brings up a lot of things for me, being a midwife, being a home birth midwife, but also like the legalities of this all and the titles and the things like that. Because I think back to my grandmom, who, who knows how many hundreds or thousands of babies she may have been a part of bringing into the world, and being stripped of that knowledge and that experience and that craft for some, outside entity to say that she wasn't enough. And so the work that I do is always, keeping that in mind. And unfortunately, being the only Black home birth midwife in the state puts a big burden on me a lot of times. But, so far we're doing pretty well. And, started having a doula team, and, working with a bunch of doulas, and, having that as a arm of the practice, and connecting clients with doulas, and just really making sure that we are doing our part in the community and outside of that community to make sure that women have not just the birth experience that they are desiring to have, but also getting the education, the support, the respectful care that they deserve. And that has always been, the highlight of what we do here.
Thank you so much for sharing. And I always say, no matter what you want to do,
Mhm.
Spirit will tell you where you're supposed to be. So I'm happy that you're following that, following your calling. Nashira, feel free to round us out. What's your why and what brings you here today?
I mean, I as Stephanie was talking, I had to pull up this picture. Stephanie was a student midwife when she caught that baby that y'all just saw say goodbye, who's now 6.5. And that's right here in this house that I'm tuning in from today. So just always an honor to be in your presence. And we have a very special bond. You never, the midwives that care for you and catch your babies change everything. So that was my my second home birth of my children, but the fourth home birth that I've been to, because I, as a child, was at the births of my siblings when I was 7 and 9 years old. And then I gave birth here, once in Dorchester and once in Mattapan. And I'm a public health person by training, so I'm not clinically trained. I come to this work having spent the last 20 years working on maternal and child health and racial inequities in maternal and child health, mostly government-based strategies. And then, it had this incredible, my first home birth was this incredible experience, and really began to dive into why we can't, why access to safe midwifery care, luxurious spaces, home-like spaces is limited to your ability to pay for it. And the public health person in me was like, how do we scale that? And it turns out that midwives have been trying to open a birth center here in Boston for some 40 years. So I asked for their blessing to step in and try again, and that was 10 years ago. So I'll talk more about neighborhood birth center later, but that's kind of how I got here. And I'll just say that we've been working on it, and things are hot right now. Like, things are moving. There is a portal open, right, that I think was cracked open with COVID. And I remember texting Stephanie. People were asking us if we're open, and I'm sending them to Stephanie, and she's like, everybody's coming to the home birth midwives, and everyone was quickly at capacity. But people were all of a sudden jolted into a reality that they may not need to give birth in a hospital, and the hospitals were overrun with COVID-19, and you were birthing alone and didn't have PPE. So, right, it was like we were in a crisis, but it kind of cracked open this this opportunity to remember, right, that the midwives have always been here catching babies. And so our work at Neighborhood Birth Center is about advancing reproductive justice by reintegrating midwifery care into the community in a full scope midwifery-led birth center that will be covered by insurance in Roxbury. So I'll end there.
Beautiful. I just want to just like take a moment and just say again, thank you all so much for like standing in place for all of us, right? Because I know we all wouldn't be here without someone who was thoughtful, who made a way for each of us to live and to thrive. And I know the first steps are always about that birthing journey. So I just want to say, for each piece of the maternity health ecosystem that you all play in, I just want to say thank you. for, you know, creating community and lending yourself to spaces like this so we could get to know you all better and how we can support you. But you know, for moving on, before I start to fangirl and just make this like a phone call, because I'll do that. At Vital Connections, we're clear that the health inequities we're facing today are rooted in structural racism, and when we look at maternal health inequities, we know that water's wet. We know that this is very true when we look at the numbers, that especially what we went over before. And while maternal health data isn't looking great for anybody here in the US, racism is embedded in our healthcare system, certainly and it has a disproportionate impact on the devastating outcomes we see for Black birthing families. So, given all this, how do you feel the work you're doing is contributing to a more hopeful future for birthing families here in Boston? That's for anyone.
Yeah, I can start. I think for me, being an option for women. One of the things that when I do consults, I always express, you know, home birth is not for everyone, and I completely respect that. However, even if home birth is not a right fit for you or for whoever, there are other options to help get you through this process, right? So having a doula, having childbirth ed, having classes. I do group prenatal care now. So like there's different ways of trying to get this information out there so that women don't feel like there's this one and only way to get to, you know, having a safe, healthy birth and labor. And so my contribution is, of course, in the workforce doing this work. And as I mentioned, you know, I'm the only one. And so, you know, sometimes there are some limits to the things, but then I bring in other people, which is why I have the team of doulas that I work with. I work my birth assistant, the person I work with is a RN, and, you know, where she's actually going to school to be a NP so that we can start doing GYN care and things like that. And so, and being able to connect with people like Nashira, who's like, you know, she has this birth center, and whether people want the birth center or don't want the birth center, and also, or may not want to go that route, but want to be at home. And so now we're opening, like, and I love the word portal because I think that is the perfect analogy. COVID really opened that portal for a lot of this, not just the conversations, but for people to start researching and looking into what other options were out there and what makes sense for them and their families. But not just that, but looking into how they can be healthier, how they can be educated on the process of pregnancy and labor and birth. We're still working on the postpartum part, but you know, all these things together make a difference. And I know we're just kind of at the tip of the iceberg right now because we're still kind of, I feel like, a long way from everyone knowing this information, but we're still out here just kind of trudging along to get as many people access to this information, and so that they know we're here, that they have options, they have there are ways to lower their risk factors by doing certain things. And I think all of us collectively, I'm not sure if everyone on here is from different organizations or from the community at whole, but I think anyone who is working in this space is all contributing to trying to change these numbers and be positive forces in this space.
Thank you. Anyone else want to chime in? Yeah, go ahead. Dr. Swedarsky, go ahead.
Thank you. So I believe the question is, how is the work I'm doing contributing to equal the playing field for birthing mothers? And I have my passion has been working more upstream as a person, like I mentioned, growing up in poverty, growing up hungry, having a parent that was incarcerated for a decade. These are the types of things that affect our health, and that data comes up, you know, in we look at adverse childhood experiences, for instance, you know, this is data that was published in 1998, my first year of medical school, but I didn't learn about it till I was 40. So I like to link so people don't feel shame around why is diabetes showing up? Why is high blood pressure showing up? Why maybe you be more likely to have, multiple partners that may lead you into my office instead of feeling shame. Let's get some perspective on why our communities are sick. Looking at our adverse childhood experience data, that was mostly published around white people. Many Black individuals were excluded from that data. And you look at the history of structural racism, that's the biggest adverse childhood experience in US American history. So we don't link it. We're not linking it. We're not linking it in the medical community with what's happened historically. As we see, we're trying to dilute American history. So I love to be in my space, to go into spaces where potentially a physician who is trained may choose to work in private practice because it's more comfortable. I love working in community health. This is where I feel aligned. I may not have an office. I don't have my own nurse or staff. I do a lot of things on my own, but I feel like my work is putting me in the space with patients that have navigated these tough social environments as I have, and they deserve to be healthy. And we all, without our health, it limits our potential to dream and to be a midwife or go to nursing school or open up a birthing center or be an electrician or a carpenter or whatever it is that we choose to be. So I know that health is foundational because health issues showed up in my own life in my 20s during medical school. And so it got me thinking really deeply, why do we get sick? Why did I get sick? And so when I'm in spaces, I feel that my work is really about educating women one patient at a time, offering tools so that she understands what her options are, what her body may be experiencing. And I also have to say, I don't talk about this. You wouldn't see me in a grand rounds in an academic space, but in that personal space, the whole mind, body, spirit connection, the thing that Black and BIPOC people really we know is that our mindfulness practices, our spiritual practices are just as important to us as going to the doctor. So I think just being in those spaces where I can offer some direct educational tools and to say, what are your goals? How do we get your needs met? And what often comes up too in the gynecology space when you're working upstream is these other factors. I often don't just treat a fibroid or an ovarian cyst. Women come in with issues going on in their life. They're in jobs that they don't love. They're experiencing racism. I've had Black women come in my office and just cry, and doctors too, Black physicians. So we don't have armor as doctors. I think there's a lot, we can make kind of stereotypes around each other. But being in that space, we often get into the psychological aspects of what it means to live in this country as Black and BIPOC women. I have a large Latina patient population as well. So it's in terms of what's going on in your life, what's going on in your relationship, what's going on in your job that's contributing to your health. And the way this comes into play is there's so much funding and time spent on women who are pregnant and who have birthed and had a bad outcome. I feel we need to spend more time before that event ever happens. So a couple weeks ago, I was at Boston Latin School. I was invited by a young group of women. They have a group of Black young women that meet, and they had many amazing questions about their health and about sex and about when should we be having sex. And as we know, infection is one of the leading causes of premature birth and low birth weight. And sometimes that can be infections that we can't identify. Sometimes it can be sexually transmitted infections. We look at hypertension and diabetes. So there's a lot of funding and discussion and press around that pregnant and birthing mother. But what about capturing that way upstream? So when someone comes to my office and she's having pelvic pain, and I'm looking and I'm seeing that her blood pressure is elevated and she's 30 and has been elevated for 4 visits and it hasn't been addressed. This is how we can prevent poor birth outcomes, is we have to spend more time working upstream. So I feel like I plant myself in these communities because I am the community. I represent that patient, that woman, and we are often not seen. I mean, you have to ask yourself, how many community health workers sit at the table in spaces where big decisions are made? And if you ask a community health worker what they need to take care of patients more equitably, there would be major changes, I think, in Boston and probably in the data. So that hasn't, so I say one patient, one woman at a time. But my big dream, and Ayana, you've known some of the events that we've been putting on, is to create these spaces where women gather for the purpose of education and healing. And that's where these educational series come from, so that we learn and then we teach each other. And then we're in that doctor's office space. We speak up and we speak out, or we come with support. Just a quick story, and I can make space for Nashira. I remember when I was a 4th-year resident, and I was pregnant with my daughter, and I was over 40 weeks pregnant. And we know that 40 weeks, 41 weeks, increased risk of fetal death. And the culture has really changed, but at that time, there was a lot of emphasis on work and getting the work done, and people were hoping you didn't go into labor. And I'm like, I'm 41 weeks, I'm out to here. And I remember one night I was on call on labor and delivery, and we work a 15-hour shift, and Zoe wasn't moving. My baby wasn't moving. When I ate and I drank, she would move all around. But because I had the education about doing kick counts, and that I realized that she wasn't moving, I could advocate to go get what's called a biophysical profile, where they look at the baby's breathing and the movement and the amniotic fluid. But as a Black woman with a medical doctorate, with an MD, an OBGYN resident, months from being done, I had 2 biophysical profiles and had to advocate for my own induction of labor, which ended up in a C-section. I mean, she was stressed when she was born. And so I put myself in these spaces. I do the work that I do because the more that we know, the healthier we can be. And it is definitely up to the doctors. We should be educating, we should be advocating for our patients. But when that's often, as we see the data, we're home with ourselves more than we're in front of a physician or in these healthcare spaces. And so I do feel like that component of education is really important.
Thank you for that. Nashira?
I feel really just eager I know you want to open it up. I think the thing I just want to add, and I'm just gonna share screen again because somebody gave me a liberty to share screen. So I just want to share what a rendering of the birth suite will look like, or an early rendering. We want to have a lot of community input, but just to give folks a sense of like what's possible when we take racism and capitalism out of the center of healthcare and put love and safety and sovereignty at the center of the design. So I won't spend a lot of time. I just wanted to share this and invite folks to get a visual sense of what's possible with community birth.
Yes, and actually, I'm gonna kind of get into community birth because it's perfect. Because just thinking about all the work that you do, it's truly inspiring. And I know we've, as a community, we've kind of seen the evolution of the neighborhood birth center and folks getting to know about it and counting down the days for it to open. So we're just really excited to be a part of that journey as residents here. And I know for us at Vital Connections, our work is rooted in the belief that redesign of our health ecosystem is both necessary and possible. So, with our work, we strive to heal systems of care and the ecosystem at large. And it's focused on redistributing power in the community, which I know each of you play a really instrumental role in. Mobilizing grassroots efforts, ensuring that community members are both drivers and stewards of this redesign process. And in this vein, I think we can learn a lot about the work that you're doing this year, as I've stated. So before we get into a little bit more about the Birthing Center, I want to pause and show a short clip to talk a little bit more about the Birth Center. This is just to introduce the larger audience to what's going on. I know you shared that great rendering, but we did a little digging and we got a video, so we just want to take a moment and share what the neighborhood birth center can look like.
Mama, can I hear my birth story?
Of course, my love. I found out I was pregnant in the fall, just as the trees were shedding their leaves. Like the trees in nature herself, we began preparing for a new season with so much joy and excitement, readying our home, our community, and dreaming of your arrival. But you have to understand, little one, that back in 2022, many of us were still afraid to give birth. All I ever heard was how much it hurt. And the healthcare system was so broken. I saw the worrying headlines about birth outcomes in the US, and the stats were especially bad for Black people. My prenatal appointments felt rushed, and there wasn't time for my questions and ideas for your birth. I longed for something different. After each appointment, I went on long walks to breathe and return to my joy and the initial spark I felt when I first learned of you. One day, a friendly doula handed me a flyer for the opening of a neighborhood birth center, a birth option providing care differently for the many folks who can give birth safely outside the hospital. Neighborhood birth center's grand opening began with honoring the land, the elders, midwives, and leaders in the community who sowed the seeds and nurtured them. Then they thanked the many community members who helped the birth center open its doors. They spoke of how our bodies carry the trauma of the past and how pregnancy is a unique time to heal. How healing care can ripple across generations. How birth center care is safe and produces better outcomes. How this care was intentionally nested in our community, a step towards intergenerational healing. Though I hadn't heard these words before, I felt in my body and soul I was in the right place. After one look at the birth suite, I knew this is where you'd be born. I asked one of the midwives how I could become a patient. The process was simple since the birth center accepted all types of insurance. At my prenatal appointments, my midwife took the time to explain everything, and I felt my decisions were truly my own. We talked about what foods to eat to help you grow strong. With her care, I continued to have a healthy pregnancy. The birth center's other offerings like prenatal massage and Reiki made me feel so nurtured and held. And when the contractions first came, we called our midwife, so excited that it was almost time to hold you. When we got to the birth center, our suite was ready. I labored for many hours, but the freedom to move and the many supports in place, along with the guidance of the midwife and the comfort measures from our doula, eased the pain. Finally, I felt the urge to push, and I felt so powerful bringing you into this world. As dawn broke, you uttered your first cry. I held you and your dad cried. My mother and grandmother were with us, and all I could think about was how much I loved you and how much everyone in the room loved us. 4 generations together, rooted in love, and you welcomed with love. You started nursing, then dozed off to sleep. I laid back on the soft pillows next to Dad, and we rested together as a family of 3 for the first time. And you, my love, were the first baby born at the neighborhood birth center, the first of thousands. Your birth meant so much to so many in Boston because together we were remembering what our ancestors had known for generations before us, and we were planting seeds for generations to come. Now in our community, people have a choice about where to give birth. We invite you to join our story.
All right. So I think that was amazing because I think that definitely paints a picture about what birthing can be. So I just snaps and claps to everything. So folks in the chat, you can always feel free to share your reactions to what we just saw. It was a great explanation about what a birth center could be. And also keep in mind, we're going to open it up for questions soon. So if you do have any questions that you're thinking about, feel free to put them in the chat. But while everyone is pondering on that, Nashira, can you tell us about how your work in creating the neighborhood birth center is contributing to this process of shifting power and healing maternal health here in Boston?
Yeah, thank you. Thanks for sharing that. As it was playing, I texted Jessie Leroy, who worked here at Neighborhood Birth Center for 2 years and wrote the script for that. She has since gone to midwifery school and is at Yale, but I texted her and we launched that video 2 years ago on Black Maternal Health Week, so I let her know it's still hitting, it's still getting love. Yeah, I mean, this work is, as you said, Ayan, like all about shifting power and building power in community. And I think Ariel said it at the top of the hour that when the folks who experience the worst outcomes and experiences design and lead the interventions and lead us to then we lead everyone to liberation. Like everybody gets free when we make sure that the folks who have the most intersecting boots of oppression on our necks are well and are in this case receiving optimal reproductive health care. And so this work has always been about both reclaiming midwifery and also doing so in a way that is really intended to to scale community midwifery. I mentioned earlier, like right now, and I just hate when Stephanie's like, I'm still the only Black home birth midwife in the state. I'm like, I know it. I say it all the time. And when I hear you say it, it still is it's a thing here in Massachusetts. And there's one birth center in the state that's open. It's Seven Sisters, and it's out in Northampton, out in Florence, Western Mass. And so we really, for a state that boasts all of the healthcare prowess and power that we do, we rank 32nd in the country when it comes to the integration of midwifery. We're not really doing that well. So back to your question about power, this is about Black women, Black and brown folks, queer folks, trans, disabled folks, poor folks coming together to think about what it looks like to reclaim midwifery and to do so in a way that is rooted in abundance. One of the things that has been really challenging in the last 10 years is looking, I've studied all of the business models. I've met with birth center leaders across the country. I've visited dozens of birth centers. And what I hear is like midwives aren't getting paid. They're working 90 hours a week. They're accepting, cash pay only because the insurance reimbursement is trash. And so they can't actually make enough money by accepting your insurance, and certainly not Medicaid. And so really, we've been working on trying to crack the code and figure out how to do this in a sustainable way so that the midwives at Neighborhood Birth Center work, way less hours, like 40 hours max, and that they have their own paid time off, and that they, earn a salary commensurate with what midwives at the Brigham earn, right? We're not looking for anyone to take a pay cut here. And I don't think it's sustainable for midwives, for birth centers around the country, to be operating on the goodwill and the blood, sweat, and tears of midwives. And so a midwife said to me once, a thriving midwife makes for a thriving community. And so our real commitment is to, design this centering, Black, brown, queer, poor folks, and to center the midwives in that, right? How do we create a space where midwives, as someone who's not trained as a midwife, I see my role as an administrator almost to play, I don't have the good sports analogy here, but to play some kind of like a defense to ensure that like I can write the grants, deal with the permitting, deal with all the fundraising, all of the stuff, so that the midwives can do the sacred work that they're trained to do, and not be taxed, with fighting insurance contracts. And so we're just taking a different approach here, and I'm really excited about what it means for Boston, what it means for Eastern Massachusetts, and what it means for other communities in Massachusetts to build birth centers. We're still in a moment of like proof of concept, because we do have to wrangle these better insurance contracts from the payers. But I think it's really possible, and I think the portal, is still open. There's leadership from the city level, all the way up to the governor's office, and to Congress, and it feels like a real moment here. And so we're going to get open while the portal's open, and then try to replicate this in other communities.
Yes, thank you. And you definitely touched on something that's, as I get deeper into the maternal health space and learn more about the surrounding care when it comes to birthing journey, I've learned so much about doulas and midwives. Let me tell you, that is truly selfless work. And Stephanie, that's just another point to say thank you for all the work that you do. The only is very lonely, and we want to make sure that we have more support for you, that we can create pathways to have more doulas, more midwives in this space, so you don't have to be alone. But with that, now that they're becoming more widely known and appreciated for that matter, right? I mean, yes, for what Nashira said, there's a long road ahead, but at least there's more visibility, and we're starting to have those conversations about the needs and the roles that midwives and doulas play in the birthing journey. But Stephanie, can you help us understand why this kind of birth support is uniquely impactful for birthing families, and what systems of care can do to better support this growing workforce? Because I don't think that doulas or midwives are going anywhere. Of course, they need to grow, right? So, what's your bird's eye view on the doula and midwife workforce?
So I think it's definitely, there's a lot of attention towards it right now, which is a great thing. But I'll speak on the doula workforce first, just because I think there's more strides happening in that space. People are becoming more and more aware of what a doula is, seeking out doulas. Um, uh, wanting to be within the workforce, because it's a fairly easy way to get there. Typically, it's a training for a specific amount of time, and then there's a list of prerequisites or tasks that they need to do to become certified, or to finish the training to become certified. And then once they're completed those tasks, they can go ahead and start accepting clients, and just kind of depending on the city or town or state that they're in, you can be really successful in this work. And so um, I think that kind of future is growing for sure. There's very few barriers for doulas to get into this workspace. And so that, I think, won't be too much of an issue. Midwifery, on the other hand, is a different animal. Becoming a midwife, and the reason why I am one of the only midwives here, is that getting to this space has been and is currently and still very very challenging, particularly because the numbers are very clear. We only represent about, I think it's either 7 or 10% of the entire midwifery force as people of color. So, and that's including home birth and nurse midwifery. So, that is, in this day and age, a very clear indication of, why are we here, especially because as women of color, and Black women in particular, we were the dominating force in midwifery at one point, right? And it's not that far removed. It's only about 50 or 60 years and beyond that was the case. And so getting into this space is not just about an educational space, but financial. There is so many barriers financially, because the majority of not just programs, but the apprenticeship requires not it requires a commitment of being on call 24 hours a day, 7 days a week. So for most people, especially for Black women, we typically have families. We typically have responsibilities. We're coming from single parent or single headed households. And so we have to work. We have to bring in income into the household. And how do we do that? Take care of our families and our children, and, take care of ourselves, and do work that requires their level of responsibility 24 hours a day. I say that with complete understanding that I had the privilege of having parents that were able to take me in with my kids. My oldest was older. My kids are 10 years apart. And so my oldest daughter was already grown and out the house, and my youngest was probably about 13 or so when I started school. And I had to go away 2 weeks every 10 to 12 weeks for 3 years. And that meant that somebody had to watch my daughter, but that also meant that I lost my job, which is how I got connected with Ariel and Maisha. And thankfully, they were able to help me, get into Brigham where I could work part-time, and they understood that, this is something that we know she's valuable in this space and we can work around her schedule, so that I was able to, care for myself and my daughter and pay for the back and forth of getting to school. But then also being on call, having someone being able to take care of my daughter when I had to go to her birth or had to do prenatal appointments or postpartum appointments. And doing that at a time where racial tensions were extremely high. It was the middle of the Trump election period, and I'm in the corner of Maine, in the whitest part of the whitest part of Maine during that time, which was very scary. I will definitely admit that. But to kind of put it in perspective, when I started school, there were 10 Black women that started class with me. I had 9 other classmates that started midwifery school with me. And at the end, I was the lone person that graduated, just for various, they couldn't deal with being up in Maine. They couldn't deal with, finding childcare when they were up there for 2 weeks. They had to go back to work full time. They couldn't find preceptors close to home. If they did find a preceptor, they were driving 2 and 3 hours, away from their families just to do a prenatal appointment. Again, when I talk about my story, I talk about how things really aligned for me. And so I understand that, I was definitely privileged in a lot of ways that a lot of Black women do not have the same advantage, of course. And so here we are many, many, decades later, and there's a lot of gatekeeping, there's a lot of struggle to get to this space. And thankfully, there are people and organizations that are trying to change that and trying to dismantle a lot of those barriers, providing scholarships, providing access to schooling. But the preceptorship is huge. The majority of people want to precept with practices that are people that look like them, right? And because the majority of the workforce is white women, they have control over how this all works out. And so that becomes a trauma, and myself included. It took at least 2 years for me to get through that space, and knowing that everything that I had to go through, everything that I had to deal with in that space, because I was only in my apprenticeship, only seeing, with the exception of people like Nashira, I think I had like maybe 3 Black clients in the 2 years or 2.5 years that I was doing my apprenticeship. Seeing women who didn't want me to touch them, who didn't want me, I felt that they didn't want me in their space, but they're being politically correct and not going to tell, my preceptors that's the case. So they kind of bared it and let me be in that space. But I felt it. I knew that that's what was happening. And so how will we change that? I think it's going to take a lot. And I think we're moving in the right direction to make those changes. Jenny Joseph she opened, I think, a year or two ago, the first Black midwifery school that's MEC accredited. That makes a difference. My school actually closed right after COVID. So having her, kind of replace that. And there's National Midwives College, I believe. There's a Black woman who's ahead of that, Tanya Johnson, and we're making strides, but we have a long way to go. We have a long way to go. And then I think the last piece to talk about is what Nashira touched on as far as being in this space and doing this work and being reimbursed. It is the hardest job that I've ever had to do. I love it. But I also burnt myself out incredibly because in order for me to do this work, I have to take on a certain amount of clients to make this sustainable, right? And I only do cash pay because of that. And for people to say like, oh, you know, we're striving to get Medicare coverage and insurance coverage, but if we go to other states and ask them what that looks like for them, they will tell you it's pennies on the dollar than what we charge, right? And so it's going to be very unlikely for a large force of us to work in that space, in that capacity, because it's not going to be sustainable. Instead, it means we have to take on probably double, triple, or quadruple the number of clients to make up what we could make up for cash pay clients, right? And so that looks like more burnout, more people leaving the force, more people not wanting to be here because they know, you know, the stresses on our bodies, the, you know, potential medical complications that could arise, you know, the list goes on, and I can talk about it forever. But essentially, I think we are moving in the right direction, but I do think we have a long way to go. But I think we continue to have these conversations, continue to make things like scholarships available for the students that need it, and have the access to the funding and the preceptorships that are required to do this work.
Ooh, that was a word. So I know we've got a little bit of time left for Q&A, and I want to make sure that we get some of these questions in, and I'm gonna like pivot back to make sure we get some more folks in on the conversation. But I had quite a few questions messaged to me, as well as we collected some questions ahead of time. So I just want to insert them in here, so that way we can kind of get a little bit more of community input. And please, if anything sparks for you, please feel free to message it to everyone, to me. More than happy to make sure that we hear you out here. And even if you want to ask your question yourself, feel free to raise your hand as well. And then I'll just make sure that we pass the virtual mic so you can do so. But one question we did get in is, how do you see collaborative community education and engagement programs fitting into the work that needs to be done in the maternal health space? And that's open to anyone. Okay, Dr. Swedarsky?
Yes, as I've been listening to Stephanie and Nashira, I love this question. I think sometimes as a you know, conventional trained OBGYN, sometimes you, especially as a Black woman, I feel like we're on the team too. You know, I think I feel sometimes when I'm in these spaces that that there needs to be more collaboration. I think your efforts and what we're experiencing, those of us who are really, I mean, 30 million patients are served in community health centers. Community health centers were started right here in Boston to achieve health equity during the civil rights movement. And I think we have to go back to that education. So I love whoever asked that question, because I know sometimes I feel like I want to be on the team. Like, I love the idea of a birth center. Stress is linked to preterm birth, right? And I know what it was like being one of very few you know, African American women in my training program, and what it's like right now to be and you know, the only African American woman really working in community health. And what that space is like, and some of the things Stephanie had talked about, we're experiencing it too as Black providers, and data shows Black doctors create healthier communities, but Black women only comprise 2.5% of the MD workforce, and we're up about 6% with Black men and women total. And what we don't ever talk about, because is that there's different, you know, experiences of Blackness, like, you know, African Americans growing up in this country and navigating the healthcare space, to they historically have some trauma that lives within our bodies as well. And so I feel like this community collaborative effort is really important, because we're struggling with the same things in community health in federally qualified health centers, and even health centers owned by major hospital systems, you have to look at what is the payer mix, how are providers paid. There are studies looking at this, that we have amazing collaborative programs within those health centers. You can have an internist, a med peds, a pediatrics, and an OBGYN and a dentist all in one building. But is there equitable pay for equitable work? Are providers spending time on paperwork and things that their colleagues in the hospitals are absolutely not doing? Absolutely. Is there a nurse-patient ratio the same in a community health center, taking care of a more diverse patient mix where there may be multiple languages spoken compared to main hospitals? Absolutely not. So I think if there is more community collaboration, like the neighborhood birth center, and creating a space to say it's community health in general, it'd be more powerful. And so Nashira, I'd love to talk to you one of these days, because these are things, this is the data we really need, like what's going on in the community health centers in this country, because these are the patients and the providers that are going to feed the birth centers, because we know just how important it is. If there was a birth center that was an option, I would have been there. I was very stressed out about giving birth in a space that I worked in, with some of the dynamics that exist on labor and delivery, even sometimes between that doctor-nurse dynamic, which in my mind, there should be a collaborative, we're a team effort. How do we get women into a space of delivering a healthy baby? It is sacred work, and it's sacred work for everyone. And so I feel like it's a very important thing to bring up, is just more collaboration. And I think also educational programming where there is not an us versus them. I know where my heart is. I know where many of my colleagues' hearts are. I talk to Black women all across the country. We're on the phone with shared experiences, trying to talk about the trauma we experience working in predominantly white spaces, and what happens when we speak up and speak out about the inequities that exist. It's a hard space for us to be in. Sometimes you have, in order to advocate for the patients that we serve, you have to do it in a certain way. And so I think collaborating in community, grassroots organization, working with a neighborhood birthing center, and individuals like Nashira, you have this background in public health, and Stephanie, your experience sounds similar to what many of us Black doctors are experiencing, is very powerful. And how can we bring educational tools to the community so Black woman feels like she can be safe and choosing also, choosing a midwife or a medical doctor, or that she can feel safe honoring her own choice. We talk about this with breastfeeding also, like not shaming people, but at least presenting the data. And so I think community collaboration will create an overall picture for that patient on what their options are, so we can meet people where they are, and they can then have choice and have agency and power in their own choice in terms of where they get their care. And I think without community collaboration, we're missing the boat that doctors in community health centers, midwives working in predominantly work in community health centers, that this is also a huge point to look at access and equitable care, in terms of providing resources for us to care for patients. And that if we're doing this work together, I think we can all go further, because the patients that the midwives are getting are our patients in the community, right? But you're seeing a different clientele, Stephanie. It sounds like there's a privileged clientele who can choose this option. But for those of us who work in the community, and women want this option, but it's not available to them, it all starts with their medical care in every way: the primary care physician, the internist, the pediatrician, and where their physicians work.
Yeah, I want to make sure that I get either Nashira or Stephanie in on this one, because we got a few more questions. But do either of you have some thoughts about collaborative community education, or thinking about engagement programs and how to better educate the community about maternal health?
Yeah, I'll just answer briefly. Community engagement is a huge part of our work. We have a staff of 5, and 2 of those staff are fully dedicated to community engagement and really narrative work. We know that we could spend all of our time scrolling away on fundraising and contract stuff and floor plans, and cut the ribbon, and folks will say like, what? You want me to do what, where? But I had a doula, like, what's a midwife? Like, so we're like just absolutely super clear that our work to engage community, to answer questions, to assuage, concerns, is really important, in the years even before we're open, and certainly well after we're open. So we launched some programming last year, and then brought it to scale this year with a series. So we offer Empowered Birth series. It's 3-part series, 1 in person and 2 online, and then same format with Postpartum Power, which is a really beautiful workshop to get people thinking about what's possible in the postpartum period inside of the current constraints of capitalism and racism that we live in. And so yeah, I think, engaging community is a big part of what we're doing now, and we want to do so much more of it when we're open. We also have ideas this year about, meet the midwife gatherings, so people can come out and ask questions and get more familiar and understand the difference between a midwife and a doula. And then we're also doing a lot of policy work. And so getting folks engaged in the policy work that is really, that's where we'll be more sustainable, like, right? All of the, right now, we have an action item out right now. I'll drop something in the chat. Really looking for folks to take 15 seconds to support a line item in the state budget that would bring $500,000 to Neighborhood Birth Center and $300,000 to the birth center out in Western Mass. And so I'll drop that link. But yeah, we're trying to engage on all fronts, and think that that's a really important piece of our work, and also engaging men and non-bio parents, and planning some groups for queer families, and just really thinking about like, how are we out here, in the next, it'll probably be at least 18 months, almost 2 years before our doors are open. And so how do we have a presence? What is our offering right now? And we're thinking a lot about that and offering as much as we can in community spaces until we're open.
Thank you. Stephanie, do you have anything to add to that one?
Yeah, I'll be quick. Yes, collaboration we love it. If there's any organizations or providers that would love to collab, we are open to all of that. It's actually one of the things that prior to COVID, we were doing more of, and now that it's busier, we've kind of come away from that, and it's not because we don't want to, it's just don't have the capacity to do it. So, and we don't have a structure. So if we knew that there were opportunities to either engage with conversation or programs or what have you, we could then incorporate it into what we're doing. Although I will say that my nurse has been on me about this forever. So hopefully in the summer or early fall, we will get back into doing more of like the meet the midwife, meet the doula nights, doing other things. We do have our postpartum group, but it's right now specifically for the clients that I've worked with. So opening that up, because that is something that I'm really passionate about. I think we don't spend a lot of time, and clients don't spend a lot of time preparing for their postpartum period, and they typically are isolated and have lots of questions and concerns. And so opening that space up for the community as a whole, would not only just provide more space for a conversation, but also connection too.
Thank you. And actually, I'm gonna come back to you, because another question came in, Stephanie, that I think you and Nashira both can answer, because it's about midwifery and the birthing care center models that we currently have in place. What are the biggest barriers to implementing and scaling models that are sustainable, that are equitable, and that can really make an impact in turning these numbers around? Because as we've discussed, there's a lot of great progress happening, but we're up against a lot. So what are some of the biggest barriers that you're facing right now with trying to, one, expand midwifery in Massachusetts, and creating more opportunities for birth centers?
I think for me, it's definitely one, being the only person to do this work. Like I said, for 2.5, 3 years when I first started. So when I started, it was right at the beginning of COVID. And at that time, I was doing anywhere from 50 to almost 70 births a year, seeing home births and everything in between. And I was burnt out quickly because of that. And so I had to take a step back, which I did last year, and really kind of focused on what makes sense for me for the long term. And so I cut that number in half. And then that's why we added the group prenatal care, and also the doula component to it, to be able to financially sustain this work. But I think the two biggest barriers is finances, as I'm sorry, doctor, I don't know how to pronounce your last name, but the doctor mentioned being able to be accessible to the community members, because this is out of pocket costs. So we do get a lot of like Medicare inquiries, Medicaid inquiries, but if they're not financially able to do this, then that risks them out of this type of, not risk them out, but they're not able to afford this type of care. And so, but then what would that look like, right? If I'm doing, then it means I'm taking on more clients again, right? So I think financially, what makes sense. But I actually, I love this question, because I'm actually now thinking about it as I am gracefully heading into my 50s next year, being 50 years old, and thinking like, on the long term, what does this legacy look like, right? I build this practice, and this is, where we do really good, but what does it look like when I want to retire, or God forbid something happens to me, who is going to take over, right? And to do all this work and not have someone to like hand this over and be able to sustain this for years to come, is definitely something that's on the forefront of my mind. So really thinking that through and what that would look like. And I really don't have an answer right now. And but I know that bringing on more people is definitely going to be the solution. But without something concrete, people are not going to take this on without saying like, hey, the salary is comparable to a nurse midwife. The work-life balance is comparable to working 40 hours a week and having benefits and things like that. There may be people who are willing to do it, with less, and that's okay. But as a midwife who, first and foremost, I feel like doing this work and not being compensated appropriately is not the way to go. We work hard and we should be compensated as such. And, I have nothing against people who do this work at a discount or free or whatever. That's their calling, and I support it. And, I refer people to them often. But I think in the long scheme of things, that's not a sustainable way to run a business and or a practice, or for midwives, right? Because if we're consistently not taking care of ourselves first and our businesses first, this will not last another 50 plus years. And so that has to always be at the forefront of all this work.
Thank you. Nashira, any thoughts when it comes to birthing centers?
Can you repeat the question? I got
Okay. What are the biggest barriers to implementing and scaling these well, for you, birth center care models in a way that's sustainable, equitable, in a way that'll be most impactful to change the numbers from where they are now?
Yeah, I mean, exactly what Stephanie said, but in a birth center setting, right? So more midwives, and then contracts with insurance companies. It's true that the hospitals aren't even being paid, reimbursed what they need to cover their costs, and birth centers are being reimbursed at, a quarter or a third of that. And it's not sustainable. And so we're launching a campaign for pay parity, so that we can at least get contracts on par with what the hospitals get, that would make our nonprofit more viable. Otherwise, we are gonna have to fundraise $500,000 a year, and we've been fundraising for years already. And frankly, I'm really tired of passing the hat in people's backyards to open, a full spectrum midwifery clinic that is actually going to return cost savings to the healthcare system. improve outcomes and improve experiences. It's not something we should be fundraising for in people's backyards. So insurance contracts is my answer.
Thank you for that. Oh yeah, go on, Stephanie.
I just wanted to add one more thing, because you mentioned barriers. I think the other barrier, at least for home birth midwifery, is the collaborative relationships with hospitals and providers. We are seeing, or I am seeing, that the shift changing. So I have like providers now referring to me, and if these are low risk clients, they're like, yeah, I heard of Stephanie, you should, seek out this route. But I think we can do better. I think having someone that or having the ability to be able to call into the hospital and say, hey, I have a client that needs a higher level of care. Can we do this seamlessly is the goal for most of us, and should be part of it, right? So if they're looking at us and saying, how are we being responsible? Well, we're being responsible by knowing that this person is out of our scope of care. Therefore, we want to transfer to a higher level of care. And this shouldn't be a traumatic transfer for a client because they chose to make the decision to be outside of the hospital. And unfortunately, that's a lot of how I get my clients. They've had poor experiences or traumatic experiences with providers in the hospital setting. So they seek me out because they know they can do something different. My hope is that we are going to see a place where we can be in a collaborative relationship, that it should not be about ego or hostility or people's choices, but that we can work together to make sure that these people are getting the equitable, safe care regardless of the location.
Thank you for that. All right, we're almost there. We're almost there. I have one more question coming. I think this one is going to be fairly quick, and this one is for Nashira. Can anybody go to a birth center, or do they have to get referred or screened in?
Oh, such a good question. They don't have to be referred, and they will have to be screened to make sure that there isn't anything that would, require hospital level intervention. And so the midwives can do that, and we have a signed transfer agreement with Boston Medical Center, so we're really excited to be in partnership there, and hope to have really seamless transfers. And people can also transfer to any hospital where they're already receiving their primary care, if that's where they want to go, if they do happen to have any reason to what we call risk out of birth center care. Two things I want to say: 99% of people give birth in a hospital, and 85% of those people are low risk and could do so safely outside of a hospital in a community setting, at home or in a birth center. So we're really, there's just a lot of people who could have access to this. And what was the other thing I wanted to say? It just that, when we are at run rate, right? When we are like up and running, and I just got a new puppy and she's like right at the edge of how much she can hang out in that crate. We're gonna, do like 200 to 300 births a year. And that's what one of the large hospitals does in a week. And so we understand that like our reach is going to be small given, the population here, for those who give birth at the birth center. But we're actually hoping that our reach is much broader because of all of the programming and classes and postpartum support, and other GYN and clinical care that we can provide. So it's not just pregnancy and through postpartum, but it's also family planning and gender affirming care and medical abortion and menopausal care, full scope of what nurse midwives can provide.
Thank you. This whole conversation, I have just been sponging everything in and just been in awe of all of the work that you've all been doing, how you bring yourself into this work, how you make a space for others who have gone through birth, who are thinking about birth, or who want to just support the cause. So I just, first of all, want to say thank you. And as we wrap up, I just want to give you all kind of like the last word, right? And we can kind of do this lightning style, because I know we went over a couple of minutes, but the convo's so good, and I know we could stay here all night, but we all have lives and puppies and babies and other things. But I'll let you all go around and just give us like, what's your one call to action for all of us? How can we support you? How can we keep this movement going? So that way we have healthier births in the Commonwealth and beyond. So I'll start with Stephanie, and then we'll kind of just go around from there.
State that question one more time. How can we?
What's the call to action for us all? What would you want us to do? How can we support you? How can we support the movement?
Support more Black midwives. Want it short and sweet. If you see fundraising efforts, GoFundMe's, etc., please support. You know, if you are in a nonprofit space, you can create your own scholarship opportunity for midwives and doulas. There are definitely doulas that are where cost is a barrier to do training. And yeah, I think that's first and foremost, but also, you know, Nashira and myself, we have our own kind of thing going on, and Dr. Swedarsky, am I saying that correctly? Also, and I think if you ever see us in a fundraising space or promoting anything for the community, support us, share, you know, the things that we're doing so we can get more word of mouth and eyes on what we're doing too.
Right. Nashira, you're off mute. What's the
I mean, I've been like shamelessly dropping our policy call in the chat. Literally, it's like your name, your email, and your zip code, and it will automatically generate a letter that we wrote to elected officials in this budget week. So this is actually like we're looking at those numbers. So I'll be able to tell tonight how many of y'all did it, because we're tracking how many letters go in. So that's one. I'm gonna just drop in our social media, like follow along. We are if folks here live in Roxbury in particular, we are going to be submitting our plans to the zoning board and going for zoning relief on the property that we purchased in Nubian Square, and really asking folks to come out in support of this. We've been working, you know, to share the vision with neighbors and get feedback for a year now, and are really excited about the plan that we're going to share. So I would just say follow along with us and please come out in support of the next two big things. We need this policy win, this budget win. We need this zoning win, and we need pay parity. So follow along, and we don't email a lot. We email 4 times a year. So welcome you to join us there.
Okay. And trust me, we're watching. We're keeping our eye on it. So thank you. And this is perfect timing. So please support the Neighborhood Birth Center any way you can. And to close us out, Dr. Swedarsky, what's your battle call to all of us?
Yes, as I mentioned, I really work upstream. It's been my whole life story. So if you're seeing any programming, I'm working on branding a divine idea right now to create spaces for education, healing, and empowerment. So if you see an event, please attend and bring a friend or two. I also you know, one of the things that I vowed to do when I'm in prayer is to find my soul tribe and to take up space and ask for help. So if there's anyone on this call who is interested in the work that I'm doing, so we can work upstream before these women arrive to Stephanie and Nashira's birth center, where I can be used in service. You know, I have these ideas, but just wanting to implement them. And so just if you're seeing an event with health vows or any educational series, please come and bring 1 or 2 women with you so we can be our source of healing in our communities first. That's really my call.
All right. Well, thank you all for that. Before we go off into the evening, this does conclude the panel portion, but of course, in true Vital Connections fashion, we want to make sure that we're preparing you all to leave this conversation with resources and ways to get in touch with us and the people that you've heard from tonight, so we can continue this conversation and mobilize our community for healthier births. So first of all, every community convo, we share out a resource guide. I'm really excited about this one. This is our Vital Connections Pregnancy and Family Resource Guide, which just came out this week. It's a collection of different resources, whether you're just expecting, you're just finding out, well into the postpartum journey, and also surrounding resources when it comes to jobs and workforce development, housing. We even touch on bereavement because we understand that that may be a part of folks' birthing journeys. So this is a really comprehensive guide. I'll say it may be about 20 pages worth of information of local resources here in Boston, and it does include the folks that you heard on the call today. So please make sure that you can scan your QR code right on your screen. We'll also drop it in the chat, so that way you have a link to it so you can read it. It is on the Vital Connections website. And we also will be sharing this out via email as a wrap up, so you can have this information and pass it on to someone that you think might need it. Next slide, please. And then, of course, thank you. Thank you for sitting through this conversation, taking in the information. We saw some activity in the chat. Thank you for sharing your thoughts and your feelings, and how illuminated you were with learning about what's going on here when it comes to Black maternal health. And it doesn't just stop during Black Maternal Health Week. This is an all-year thing that we can take on. That's one step and one conversation at a time. So to let us know what you want to hear from us in future community convos, we have the QR code here for our feedback survey. And I'm also going to just drop the link again in the chat for everyone, so that way you could fill that out. It'll be really helpful for us. And also, if you are interested in getting more involved with Vital Connections maternal health work, we'll be reaching out. There's a space on the form to say if you're interested, to leave your name and your email or whatever contact information is easiest for you, so we can get in touch with you and figure out what you're passionate about and how we can connect you to the work that we're doing. So with that, I just wanted to make sure that you all feel full leaving the space with information, with passion, and with a drive to be a part of the solution. So thank you all. Have a good night. And we look forward to seeing you next month in May, where we're going to have another great community convo. Thank you, everyone.
Bye, y'all. Thank you.
Thank you for coming. Take care.
Take care, everybody.
Good night and thank you.
Night.
Good night.